It's always a little worrisome when, you know, one of your cardiologists and chief of a service is following you, so your cardiologist gets the last word there. Boy, that's great. Probably don't feel like you get the last word all the time. So it's, I'll tell you my two academic jokes that I think I can remember. The one academic joke that I remember from Penn is the difference between full and part-time faculty is that part-time faculty are only gone part of the time, full-time faculty are gone all of the time, and I'm sure it's because of their research interest. I'm looking at this small gathering, but I think it'll probably be an auspicious gathering of us as we gather the opportunities that are before us in this community. I remember the time when I was at Penn, and I'm sure Roy, when he was at Mayo Clinic, thinking that this is the center of all healthcare research in the universe as far as healthcare goes. And then the two of us end up here in Lancaster and realize all of the wonderful things that are happening in Lancaster and really the opportunity for translational research. The clinical opportunities here in this community are just phenomenal for the opportunities that we're looking at. As a healthcare system, we see every day in our hospitals as well as our outpatient areas, ambulatory care, the need for technology, planning, delivery, and services. I think that there's nothing more important right at the moment than innovation and technology opportunity in healthcare reform. We are looking at this country at a, $70 trillion gap in the Medicare program over the next 50 to 60 years. Lancaster General alone will lose in the new healthcare bill about $150 million in the next 6 to 7 years in cuts in reimbursement. So if you step back from that, you say the only way we're going to be successfully able to change the way healthcare is delivered is we're going to have to look at new therapies and applications of technology in order to be able to really reinvent the way healthcare is delivered. We heavily invest in research ourselves. We have our own research institute here. We really focus on patient support, patient safety, and quality in healthcare. Our single biggest investment this year is a $100 million investment in EPIC, which is an IT system for both inpatient and outpatient services that will ultimately cover tens of thousands of our patients, both on the outpatient side as well as all of our inpatients. It's a 4 to 5 year rollout. We have a number of local physicians actively engaged, as you'll hear from Dr. Small, in both ongoing research as well as new research that they brought to the table. They have the opportunity, although on a limited basis, to get funding from Lancaster General, but many of them have research funded through a lot of different areas as well. In 2006, we introduced the Journal of Lancaster General Hospital. It's been published quarterly since that date. The editor-in-chief is Dr. Larry Bonchak, who is an academic cardiac surgeon, who is now the incoming chair of F&M's board. He's a foremost researcher in his area, and we have quite an editorial board. So one of the things we're interested in is articles that collaborate with our medical staff to really educate about 8,000 physicians on our region about the things that are happening in healthcare today. I mentioned our research institute. We formally established it in 2004. As a community health system, we believe we have a unique opportunity to conduct epidemiologic research to answer questions that can directly benefit the communities we serve. Our Board of Trustees, through its Mission and Community Benefit Program, we have a little bit of that, I think, in the brochure in your folders, is very interested in improving the overall health of our community and really looking at ways to say, you know, we're not really in the healthcare intervention business. We need to be in the health business. We need to create a healthy community, and we need to collaborate with the community in looking at ways that we can do that effectively. Our research institute supports the research that's done by our physicians and nurses. Our College of Nursing and Allied Health Sciences also publishes its own journal as well. And both the journal and institute provide windows into the needs, resources, and possibilities for new technologies. I would invite you, if you don't already get that, if you'd like to leave your name and address, we can put your names to receive that journal. It might be interesting for you to see if there's any connections between what you do and what we're trying to achieve and what our physicians are trying to achieve here that might have some synergies. We have a family practice residency program and really trying to look at the needs of this community as it relates to primary care services. And we're working currently to extend our residency programs to some other specialty areas as well. I think our local physicians are a tremendous treasure. One of the great opportunities of being between Baltimore, Philadelphia, and New York, as we have attracted some just phenomenal physicians on our medical staff. They do everything from retooling instruments to reducing diabetes and other chronic diseases. And then if you look at some of the technologies, Roy and I were talking about when he was just employing some of the first people to deploy new technologies after they've come off the bench. We realize that we're not into deep bench research. That's what places like Penn are into. There's 130 medical schools, I guess, in the country now. About 60 of those are doing significant research. But there's a number of us that are doing applied or clinical research throughout the country. And I think in our own community, where we care for over 40,000 inpatients every year, if you were at Penn or at Hopkins, you'd realize that there's not many more discharges from those institutions than there are from Penn. So I think there's a tremendous opportunity here. We think that there's going to be an awful lot of pressure in the next couple of years to deploy technology faster, more effectively within healthcare delivery. And I think, again, I point out the tremendous opportunity that we all have to work together. I also think that we have to look in complementary medicine. There's a lot that's being done in this community as far as using complementary medicine. We have to put the science behind that to really look at what's appropriate. When you come into a physician's office and you're using complementary medicine and you don't tell them the treatments can result in disaster, so we really need to collaborate more effectively in that. Hospitals across the country are going to have two choices: close or figure out how to be more effective in the way they deliver health care. There's a prediction that hundreds, maybe 1,000 hospitals or more will close with healthcare reform. The way they're funding healthcare reform is basically cutting payments to physicians in the hospitals. So we're going to have to be much more creative than we ever were in the past. We're really interested in learning about projects that you're involved with, as well as what's happening in this community. We hope that this is an exciting opportunity for all of you. And again, as I said, from modest beginnings like this is where synergies can happen and opportunities to leverage the capabilities in Lancaster can really be fostered. So let's continue our work and our commitment. I think that Lancaster General is willing to step up to the plate along with you to be a technology incubator, to really help with technology transfer. We look at ourselves as a laboratory for our own students, and there's an opportunity for us to work collaboratively together to really take basic research and apply that research. So we have a great synergistic relationship with Franklin and Marshall and lots of different levels at the community level, but also at the basic science level. So I think I see nothing but opportunity at this time of great and really challenging but wonderful change in healthcare. I sort of painted a bad picture, but at the end of the day, I actually think it's going to be really positive for patients. Anybody who's got a 20-something realizes the 20-somethings don't want to receive health care like baby boomers like myself have, and they're going to turn health care upside down. And we really need to be at the forefront of being open to their willingness